Opioid addiction is a national public health crisis that affects individuals and families regardless of their age, race, or income. The statistics are overwhelming. More than 130 people die from opioid addiction every day. But there is hope. Recovery is possible. The information contained in this podcast is solely for informational purposes and should not replace advice from a medical provider when making healthcare decisions. This podcast contains opinionated content and may not reflect the opinions of any organizations this podcast is affiliated with. Nothing discussed in this podcast shall constitute or should be construed as endorsement by the Independence Blue Cross Foundation or Independence Blue Cross, LLC, of any product or service discussed herein. We will discuss opioid use and opioid treatment, which may be triggering for some listeners. Listener discretion is advised. Today on Someone You Know, we're joined by Bethany Franklin and Tom McDermitt from Caron Treatment Centers. Bethany is a lead family therapist and is a licensed clinical social worker, as well as a certified advanced alcohol and drug counselor. Tom is a senior regional resource director, holding a certification as an associate addiction counselor, and has worked for Caron for close to 2 decades. Both Bethany and Tom are certified as a rainbow advocate and educator. On this episode, we explore addiction as a family disease and the roles families and support systems play in recovery, how Caron is supporting inclusive recovery environments, and providing equitable access to care during the COVID-19 pandemic and beyond, and what it looks like to enter a recovery journey with Caron. I'm your host, Heather Major, and this is Someone You Know. It's a pleasure to meet you. I've had the great privilege of knowing Doug Tiemann and your new leadership and Sean Lavelle for quite a few years now, through the work that we're doing through our foundation and also the great work and leadership of Dan Hilford at Independence. And we're really excited to be able to talk with truly the what we call sort of the platinum, treatment and recovery experts in Caron. I just wanted to reinforce that and also underscore the importance of what I think will come up today's conversation, which will really be exploring a deeper dive, exploring stigma, because you all treat addiction as a family disease. And I want to explore stigma from all those facets that you see, both within the family and outside of the family, within the person, and obviously external to the person. And also talk about inclusivity, because including family in the recovery and treatment process is a very inclusive approach. So with that, if you all are great, how about we do some introductions? Bethany, Tom?
Sure. So I can go first. My name is Bethany Franklin. I am a licensed clinical social worker. I am one of the lead family therapists here at Caron. And I am also one of the therapists that run the LGBTQIA+ track for patients here at Caron as well. I've been here about 5.5 years and very happy and grateful to be part of this conversation today.
Thanks, Bethany. Tom?
Sure. Great to see everyone. And so my name's Tom McDermitt, and I am Senior Regional Resource Director. And basically what that means is I do outreach as well as working with families to help navigate loved ones into treatment. And then also help the families along the way, even once their loved one rolls into treatment. And I've been at Caron for coming up on 19 years.
The work that you both do, and obviously the work of Caron as an organization, is incredible. I've been to a few of the events where you have individuals and families speak about their experience and their journey. Very moving, and you all see this day in and day out. If you had to describe Caron in a phrase or two, how would you describe Caron Treatment Centers?
It's hard to describe it, right? I would say a very safe, loving environment to help everyone who is struggling. And when I say everyone, that is the identified patient as well as the family. Bethany?
I would say that we're an open and affirming environment, treating the whole person in terms of the patient, but also treating the whole system in terms of the family as well.
And we can explore that a little bit more, the family. You all were first introduced to me and to a lot of the folks that work here at the foundation, the concept of addiction as a family disease. Can you talk a little bit more about that? Because I think that's a really important part of addressing stigma as well as addressing inclusive recovery.
When we talk about addiction as being a family disease, we really think of it as impacting every single person in the family system, whether it be parents, siblings, children, grandparents. It really impacts everybody in all different ways. And, even though there's one identified patient that has the substance use disorder, everyone in the family system is going to react and respond differently to that individual and to their disease. And sometimes we see family members engaging in various behaviors that aren't always the most helpful, like trying to control or micromanage, enabling. So when we talk about treatment, we have to really not only work with the patient in confronting their disease, but we have to work with the family in terms of the ways that they react and respond and can make the crisis of the addiction be a little bit more unsafe for the patient and ways that they contribute to it as well.
The one thing that I would add to that is that a lot of times there's a lot of anger within the family system as well too. So you have one camp that is enabling and making sure everything's okay and I'm going to take care of this, and then you have other family members that are so angry and frustrated that they want to have nothing to do with it, and that's where Bethany's team with the that does the family work is that the addict fractures the family and doesn't even realize it. That's the kicker, right? They're out doing their thing, getting high, getting drunk, whatever, and the family system is completely fractured. And so that's why for us it's so important to do that intensive family work.
Let's maybe talk about. So you mentioned a couple of unhelpful behaviors or roots of behaviors: anger, resentment, denial, control. Let's talk about some helpful behaviors that you all see when it comes to the family engagement in the person's addiction journey, treatment, recovery.
I think the most helpful thing that the family can do is set boundaries to protect themselves, to keep themselves safe, setting those limits. And what we usually see is that the person with the addiction, their behaviors may change as a result of the boundary. But families are setting those boundaries to keep themselves safe. And I think that's really important. I think them continuing to get education on the disease and what should I be doing versus what isn't so helpful is going to be really important. And doing their own work, getting maybe their own therapist, a couples therapist, a family therapist, whatever that looks like for them to get some support because of the stigma that you touched on earlier. And figuring out ways to navigate that as well as navigate their loved one in recovery or still in active addiction moving forward.
I think that's really great, really important for listeners to hear about protecting themselves, right? It's not something that I would automatically go to because I think so much of energy is put towards trying to protect individual and control, the person with addiction. And maybe we can switch gears a little bit because you started talking about stigma, Bethany, and I think stigma obviously continues to be an issue socially, right, in our sort of environments outside of our space. But maybe we can explore it from the family perspective because that is another facet of treatment, recovery, and certainly long-term recovery that has to be addressed, right?
Now let Bethany go. Just from my perspective, there's a lot of shame. So when the identified patient comes into treatment, there's layers and layers of shame. Once they kind of clear, and they really start to look at their behaviors and what they've done, there's a lot of shame. But also sometimes there's shame built into the family system as well. Like, what are the neighbors going to think? Or we don't want certain other family members to know, or we don't want anybody at work to know. So let's keep this secret because what are people going to think about us? And and that creates a unhealthy dynamic, which we work on that as well because we like to say you're only as sober as the secrets that you're holding on to, right? So if you're gonna hold these family secrets close to the vest because we don't want anyone to know about dad who went to treatment, that's unhealthy.
And how much of this comes up, Tom, if I may ask, in your work specifically with outreach and continued support with the individual and family? Is this something that you feel it gets addressed up front, or is this something that you both feel maybe that has a more lengthier, it stays around a bit longer?
Part of my role is to work with families to get the loved one into treatment, right? And a lot of times when these discussions are on shame and we don't want anybody to know and all of that, my role is to get them into treatment. And what I usually tell families, you know what? Let's kind of put that on pause right now. The most important thing is to get your loved one into treatment. If they're willing, we need to do a full court press because that window gets really small.
Bethany, I'd love to hear your perspective as part of the sort of care continuum team, right? How does it look from your perspective?
So, like Tom was sharing, he kind of does that work on the front end. His team fills us in on what's going on with the family dynamics. And then that's where we, as the family therapist or the primary therapist, kind of take advantage of that information. And we not only work with the patient in terms of their shame and the stigma that they're experiencing, but working with the family as well. I think, one thing that I really see from a lot of family members is they place a lot of guilt, blame, and shame on themselves for their loved one having a disease. And a lot of what the work that we do with them is trying to confront some of that and helping them see that they didn't cause their loved one to have this disease. Sure, maybe some of their behaviors have contributed to the crisis, but they didn't cause this, and they also can't control it, right, or cure it for themselves. So helping them see that what their role is in it, and getting them past the fact that they can control it is really important.
It reminds me of when I first was introduced to what was the Moyer Foundation, is now Eluna, and learning about the program that the youth go through in their world. I don't know if either of you are familiar, but the 3 C's. You didn't cause it, you can't control it, and you alone can't cure it. And you just said it, Bethany. As you were saying it, I was sort of taken back to that moment, and how profound that is at no matter what age, to be able to hear that and have that reinforced, and then to be able to build those strategies around that, right? To be able to move through that thinking, and hopefully diminish the guilt, the blame, and the shame that you were talking about. Well, this is, I think, a great segue for us to start talking about inclusivity. And Bethany, you began with your introduction talking about a very specific track that you're involved in at Caron. And I'd love to hear from you both about your perspectives on treatment centers and being able to offer programs that tailor to people's experiences and identities and specific needs. That's part one. And then part two is, the vision at Caron for, a more inclusive recovery environment.
So I think one thing that we noticed is that when we treat the whole person, we do need to treat various identities that someone has, orientations. We started many, many years ago with having a weekly pride group for patients that identify as part of the LGBTQIA plus community. And what we found was that group was really helpful, and patients needed and wanted more. So there's so many layers in terms of someone's gender identity or sexual orientation that impacts treatment. Family and relationship dynamics sometimes look a little bit different. How do we stay part of the queer community after treatment while also living a life in recovery? How has spirituality impacted us? So we developed this track to kind of hit on all of those areas that maybe don't get discussed as much in just the general treatment population for this community, because we do need to treat that whole person. So in terms of that track, it's 3 groups a week plus an outside AA meeting, an LGBTQ AA meeting. And those patients really enjoy spending that time with one another. They feel that they can be more open in that setting. And I think that in terms of what other treatment centers offer. They may offer a group once a week, but I don't know of any that offer something as similar and as robust as what Caron is offering for this specific community.
It's incredible. And Tom, from your perspective with outreach and support, how much of this is part of information that you're able to provide and hopefully assist with that moment, right? You were talking about that moment in time when individuals ready and willing to go into treatment. How much of these individual and tailored sort of services are important in that process?
Especially for the LGBTQIA plus community, there's a lot of fear coming into treatment. There's a lot of fear coming into treatment no matter what population you're from. That's fearful of the unknown, what's going to happen. A lot of queer people are fearful about, am I going to get judged? It's a lot of that internalized fear that they've been ingrained, maybe they've been bullied. A lot of that fear coming into treatment is right at the surface. And, most of our programs are gender separate, so if you identify as a gay man, coming into a predominantly heterosexual community, that's a little fearful. So part of my role is to assure clients that it is a safe place. Caron has a zero tolerance for any type of bullying, whether it's sexual orientation, whether it's your religious beliefs, color of your skin, zero tolerance for that.
That's exceptional, and thank you for sharing that. Switching gears slightly, can we talk about equity in terms of access to care at Caron? I know that we've had the benefit of working together and in a more of a scholarship way to ensure that no matter what the barrier, if it's financial especially, that is not an impediment to a person or a family seeking the support and resources and care at Caron. But I wanted to hear a little more of maybe a bigger picture from your worlds about what does equity in access to care at Caron look like? I think that maybe we could talk about COVID specifically.
Absolutely. So I think that in terms of the COVID-19 pandemic, we were faced with a challenge, just like a lot of other treatment centers. I think that there were folks who, relapsed or were really struggling at that point. And we saw more need for care at the height of the pandemic, but Caron never shut down its doors or stopped providing access to care. Our outpatient programs, a lot of them went virtual. Mm-hmm. And in inpatient, even if someone did test positive and they had to be moved out of the community, they were still participating in groups and individual sessions and family sessions virtually. And as soon as we could move them back in with the community, we did, because it was really important for everyone to get that care. We saw much more of a need for inpatient and outpatient treatment during COVID. So I think it's really great that we were still able to provide those services at that time.
Do you feel that Caron was well positioned to really take on the virtual? How important was that to have the telehealth ability to reach people when need was more and so many limitations were in place?
We had to pivot really, really quick, especially the family program. They pivoted within a month or so and actually created educational videos that they would send to families so they would get the educational piece, and then they would do virtual family. In today's world, so if I'm going to be completely honest, I believe that you lose something in a clinical group if you're not altogether live. However, I do believe that having an option for virtual is important. What we have found is for folks that live very far away, don't have great access to an intensive outpatient or an outpatient, or even for therapy, or if they let's say they're in an outpatient and the car breaks down, or my kid's sick, there are things going on, they can still attend. So what we have found within our own continuum is that attendance actually was greater having the video option. So so for residential treatment, obviously it needs to be in person because you need to detox and we need to be able to get you safe. But for the outpatient and even individual therapy, I think that my hope is virtual is here to stay.
You started to touch on some things that are sort of defined a little bit differently, and maybe in healthcare space, some of the life happens, right? And for people who are maintaining recovery and trying to maintain, their journey in the treatment to recovery process, it can be much more difficult, right? All those challenges can really create stress and scenarios in which, it can be counterproductive to a person's process. At least in the healthcare space, we talk about transportation, we talk about housing, we talk about food, we talk about, maybe being able to meet a lot of those needs to be able to treat the whole person. So Bethany, kind of coming back to what you started with too, I'd love to hear from both you and Tom, from your different perspectives of where you are in the patient continuum. How much do those factors play in beyond certainly COVID and what that specific time frame where we all had to sort of pivot and adjust?
I think those factors play in quite a bit. And I think especially the financial factor in accessing services after treatment. Sometimes we have patients who really need to go to a sober living house and they want to go, they just can't financially afford to go, or they need to work, and being in that sober living would prevent them from working. Child care issues are another huge thing. For patients who are the primary caregiver to children, or split those responsibilities. So I see those things play out a lot. And it's part of our job to help figure out what is the next best option for a patient that they're able to do in terms of transportation, financially, as a parent or a caregiver. That's something that the clinical team really works with patients and families on a lot while they're here.
That's awesome. Tom, anything you want to add?
No, Bethany's 100% correct. A big part of what we do, so most of our clients are with us for a month. Right around week 2 is when the treatment team starts thinking about what's next, and it's a candid conversation. The first conversation is, this is what we feel would be best, and sometimes it's a lot more treatment, and if the family can't afford that, then we start looking at what could they possibly afford. And we have our own internal scholarship funds. We're able to, at times, based upon how motivated the client is, do they really want to continue their journey in recovery? What are the financial resources? Sometimes Caron will cover the first month or so in a sober living to kind of help them, transition. So, and we also offer quite a bit of scholarship for folks coming into treatment as well, right? And it's not free, but it's a discount that we are able to offer at times to offset cost.
Wanted to take a minute just to get your perspectives. Tom, you mentioned you've been with Caron for a while, and Bethany, you're very ingrained in the clinical space through all the work that you're leading and doing. Where would you like to see more impact? Whether it's to expand access or address more issues around equity, treatment, where do you see the most opportunity for Caron going forward in terms of its impact and ability to reach patients and reach families and continue on the mission that was started as a legacy of its founders?
My wish would be that there was a way in which that people could stay with us longer, right? So our, most insurance contracts are for a full 28-day length of stay. And a lot of times folks are just starting to land by week 3.5. So to be able to stay longer and I don't know, I would say wish list would be to allow more people to have access to our care, but even longer care as well.
I'd be remiss if we didn't have a moment to make sure our listeners knew the process for a prospective person who is ready, willing, and a family who's ready to support them in their journeys. I guess maybe Tom, does it make sense from the order in which someone may engage with Caron? Should we start with you, Tom, and kind of walk through what's the process if folks don't know?
So there's 2 ways to come to Caron. You can come through a regional resource director, which would be me. And so that's when I speak to families, speak to potential client, gather the insurance information so I can connect with our admissions team and start that process. Or people can call into what What I love about Caron is our admissions team do a thorough intake. We want to do a full intake with the potential patient. And if there are factors where Caron feels we are not the right fit, even if you want to do a full pay, we are going to say, you know what? We don't feel that we are the right treatment provider for you. Let us give you a list of 2 or 3 other programs that we feel would be a better fit. We have partnerships with other programs, because one of the worst things you can do is work with a family and a client and have them come to Caron, and within a week we realize we're not the right fit, and then we have to refer out. If we are the right fit, then we're gonna schedule a time for you to come into treatment.
I think it's a great thing for folks to hear, because that fit factor, it could make all the difference, is what I'm hearing from you, Tom. Bethany, as someone is going through the intake process and identified as someone who is a good fit for the programs and services at Caron, how does that look? How does the process look from your end?
So sometimes if someone is still struggling with willing to come into Caron, or they have questions about just unit programming, we might get them on the phone before they even admit with one of the docs or with a clinical staff member, with the supervisor of the unit, to help kind of reassure them and answer their questions. And then once they get in the doors, we're trying to meet with them as soon as we can, a member of the clinical team, to welcome them to treatment, to show them that it's not that scary of a place, that they can be open and honest, and starting to build that rapport with them. Because again, we really only have them for about 28 days, depending on their insurance contract. So kind of hitting the ground running with building that rapport, doing a lot of assessments when they first get here, so that we can put together a thorough treatment plan for them within that first week and a half, is really important.
You keep reminding me about the 28 days. May have taken someone 28 years to come to a point where they're ready to enter treatment at Caron. And, and so in 28 days, it's very transformative. And I would guess that, Tom, what you're saying, and Bethany, what you're sharing about the process to start is, in terms of what needs to happen, is very big. And, there are several things that need to be happening in real time, but needs to be quick. And so that's really an art, a true art. Anything else that you want our listeners to know about the stigma, about access to care, about being able to tailor services at Caron? Anything from your worlds or perspectives that you don't want to leave this conversation not saying?
I think I'd just like to add that there's hope, right? There are millions and millions of people living in recovery, and they have so many more family members that are also living their own recovery process. And no matter what treatment center you choose, whether it be inpatient or outpatient, there is always hope. And that's part of our job, is instilling that in patients and family members as well.
Tom, how about you?
Yeah, agreed, 100%. And that, a lot of times families feel like, oh my gosh, I can't believe this is happening to me. And they, the disease of addiction isolates the addict, but at times it can even isolate the family as well too. And even though families might think, what do I do? Reach out to, a treatment center, or reach out to, ask around. That's where that stigma is shame, right? Ask somebody or friends, like, I'm really going through this. You would be shocked to know that there's probably a lot of people that that have been going through the same thing. So don't hold the secret, ask for help. And like Bethany said, there's nothing like hope. And, I hear that when I work with families, not all the time, but a lot of times when, sometimes I'll work with families for 3 weeks or even a month. And when they finally do find their way into treatment, the family says, for the first time in years, I feel like there's hope. And that is so important.
It's incredibly powerful. And what a great way to sort of end our conversation today. Fittingly, this podcast is called Someone You Know, and we too are believers in recovery being possible. So thank you both very much for your time, and for, more importantly, for all that you're doing, not just at Caron, but, for the great work that you lead and do, and have so much expertise and a willingness to share with us today and share with our listeners. So I appreciate you both, and I look forward to our future conversations for sure.
Thank you for having us. Appreciate it.
Thank you very much.
If you or someone you know is suffering from opioid addiction, please visit ibxfoundation.org/SYK. The link is in our show notes below.